Persistent pain, there's so many different niches and areas of specialism, and Dr. Dan Kaufmann is particularly interested in migraine as a condition and interested in helping people recover from it. And that experience he has offers him and his patients routes into understanding why they're experiencing the migraine and helps them start to take the steps to recover from it. If you're interested in this area, watch the video. Right, we're up and running, Dan. Thank you very much for joining me from halfway around the world. I'm in the UK. You are in which part of America?
Well, I'm in Salt Lake City, Utah.
Salt Lake City, Utah. And I'm very grateful for you giving me a bit of your time. We talked probably over a year or so ago. We're both really interested in persistent pain. Now, what I'm fascinated about your field is it's an area of specialism I don't really deal with. I come across it with other pain problems, but you're very interested and specialized in the treatment of migraine. That's right, isn't it? Could you tell anybody who's watching this, myself as well, a little bit about the background that got you to this point?
Yes, well, first of all, I've been a scientist for 25 years, and but what I knew was that I was interested in science because I was interested in what science can contribute to people. I mean, I wanted to go to the supermarket, for example, and have the ability to have an elevator pitch that would interest anybody there, something that would be relevant for people. Now, pain is something that I was interested for many years, and I've done research on pain for different directions. I've done drug development and looking at mechanisms. And 11 years ago, I met my former boss, who was a wonderful neurologist, and he introduced me to the migraine world, which I knew, but I never researched anything about migraine. And I can very much say I fell in love with the field, and I still am. And I think what got me was the fact that, first of all, we're looking at a very high percentage of the population that are living with migraine. I mean, we're talking some say 12%, 15%. It's pretty much 15 to 18% of the population living with migraine. I think there is a lot of room for research in migraine. And when we look at drug development for migraine, it's even though there are currently new medications and there is work that has been done to identify medications, it's compared to other fields like epilepsy, for example, we can see much fewer medications on the market compared to epilepsy. And I was intrigued by migraine, and I was intrigued by what are the triggers, what is going on in this very complicated and interesting disorder. For me, what was also important was the fact that, as we see in other conditions, there are a lot of people that are living with migraine, and they're trying everything, and they're still living with a very problematic and very debilitating condition, and no medication out there, even the newer medication. There's a lot of people who are not getting the benefits from migraine, from the treatment that is available. And I was always curious about it, to know what more can be done, to help those individuals. So I've been in the migraine field for about 11 years, and I've researched the effects of chronic stress on migraine, looking from the more of the science perspective and the human perspective, the clinical perspective. And I just found it really fascinating, and I'm still very excited to keep working, to have the honor of working with people living with migraine, have them share and teach me a lot of things about their condition, so I can refine my skills and I can learn more about how to help and treat this complex disorder. So that was a long answer to a short question, but
no, it's a fascinating entry point because it comes from a science base. And the entry point and suggestion to a pathology from a scientist, in our culture is, so we have a problem, and the default is a medication that would sort this problem, whether that's epilepsy or whether that's diabetes or any pathology in our Western culture. So your entry point have been, I guess, why aren't these medications working? If they're the best of science. So how did you find the shift across to some of the subtler, nuanced approaches that now get effects that don't have any pharmacological input in the body at all? I'm not saying pharmacology doesn't influence and has its place, but you and I know people have recovered from migraine without taking a pill. How did you make that shift?
Well, again, that's a interesting and complex question. So I'm gonna go very slowly to see if I can convey my my thoughts about that. I think, first of all, science is a methodology. Science is an ability to formulate hypotheses based on observations and elaborate and formulate very good controlled experiments in order to validate or invalidate a certain hypothesis. So it's a methodology, and I think that for now this is the main methodology that helps us know whether something is really working or not, because we can have all sorts of ideas, but we need something to objectively test it, and that's where science comes from, and I'm happy I have that background. However, what was interesting to me, and I came from drug development field, what was interesting to me is the fact that talking to so many people living with migraine, and I want to emphasize medications are important. I'm definitely not going to say anything against medications or medicine. We have to have that, but it was evident to me that looking at the body, looking at the nerve cells and medications, as important as it is, it seemed to be half of the story. There is the whole emotional side, the affective side that people are experiencing as well. And that part, because it's so much more difficult to measure using scientific tools, it's most of the time neglected. And we're not aware many times that there is a very, very important contribution to our emotional aspect that has direct link, in my opinion, to migraine. And it's not just the physical aspect. And I want to emphasize, I think that in migraine and other forms of other conditions, we are physical beings, but we also emotional beings, and we need to look at both pictures. So the physical aspect, the pain is real. We know about the nociceptors, we know about receptors, drugs, medicine. We know all about that, and that is crucially important. But there is an emotional aspect that is also related to that, because whenever someone experiences chronic migraine, they're also going to be affected in terms of they're going to be depressed with the fact that they're going to have uncontrolled attacks of migraine. I mean, a lot of people are going to feel that they feel helpless and hopeless. They're starting to be anxious. When is the next migraine going to come? And those components are important to address as well as part of the migraine treatment. But more than that, if I want to go a step further, there has been a link between the occurrence of past adverse events, traumatic events in childhood and in adolescence, and the occurrence of migraine. And I want to emphasize, it doesn't mean that everybody with migraine necessarily have a trauma, big or small. However, the fact that there has been shown correlation, and there has been many studies that showed that there is a correlation between the two, and there is higher incidence of past adverse events with people living with migraine, also got me to think, how is that related? What is exactly happening that those adverse events can cause the system to react in a form of migraine? And again, I want to emphasize, it doesn't mean that every person with migraine had necessarily trauma, and it doesn't mean that if I had trauma in my childhood, I'm going to have a migraine. But it does say that the correlation between the two is interesting. I also, when we look at pain in general, and just looking at evolutionary, why is it that we have pain? But what is the purpose of pain? And I always say that because when people experience chronic pain, naturally, this is unpleasant experience. No one is enjoying having chronic pain. However, because of that, we want to shut it down. We want to tell it to go away. We want to do everything to minimize it, to make sure we don't get it again. And that's normal when we have something that we don't like or is unpleasant. However, if we want to look at pain from an evolutionary perspective, pain was created because it's a way for our system to warn us of potential or real danger. If, God forbid, I'm going to put my hand on a hot stove, I'm going to experience pain because the system is telling me, Dan, you need to take your hand off, because otherwise you're going to damage yourself. Now, this is acute pain. There's differences between acute and chronic pain. However, my hypothesis, and again, I'm still working on it, but I'm always wondering, when people, if we look at migraine, when the system is caught up in giving or producing chronic headaches, chronic migraines to people, I'm always wondering, is there something that the system is under the impression that the individual is in danger and it needs to warn them from? And again, this is my hypothesis that I'm working on, but with the people that I've worked with, a lot of those danger signals are emotional, meaning a lot of people are complaining that when they get stressed, they feel a migraine coming on. When people are engaging in negative self-talk, like, this is never going to go away, I'm always going to be miserable, and so forth and so on, that doesn't help migraine. That's actually exacerbates migraine. So all of those signals, that are not necessarily physiological, they have a physiological consequence, but those emotional components are interesting to me to keep researching, because those might be cues for the system that gets it to identify those as danger signal. And when the system feels that it's in danger, it's going to produce a danger signal in the form of pain. So I'm curious and keep identifying what can be other emotional components that might be causing migraine. I'll give you an example. When a kid, let's say 3 years old, and as kids we're dependent on our parents, and let's say that kid is at home and mom leaves, and all of a sudden the kid is afraid, because what if mom doesn't come back? What's going to happen with me? I'm in danger. So this idea might have been cemented in the system, that whenever they have a sense of abandonment or someone leaving them, the system identifies that as a danger signal, and it might cause a migraine phenomena. So this is what I'm saying, that there's a lot of emotional cues that we might have learned throughout life, and by identifying those cues and those avoided emotions or avoided needs that we haven't addressed. What I found working with people is that when we identify those cues and we're able to express those needs, or it's like update the system that it's not in danger, that has an effect on migraine. And so this is why I'm, beside the science part, beside the medical, pure, looking at nerve cells and all those important things that are important to research in the migraine field, I'm curious about those things that are more difficult to identify in research, like those emotional components, and how are those related to migraine.
So what you're saying there is that, or if I understand it right, is that the system, this internal intelligence, is sensing danger, and that output is pain, and the person hasn't yet understood the true meaning of that message.
The system, the person, yes, it's like the system is operating under this assumption that there is danger, so it tries to warn the individual. That's kind of what pain is, a warning signal. It's an interpretation of there's something is dangerous, something I need to warn that individual. But when we are not aware of those emotional cues or those emotional triggers, because again, we can't put someone under a test or a blood test or find that out, it's much more difficult. And those are the things that are interesting to me, because again, I work with many people who say, oh, I talked to this family member and immediately after that I'm getting a migraine. Or you hear about incidences that a physiological response occur in response to some emotional cue. And that is interesting to me to identify the connection. Why is migraine comes up after someone is had a fight with, I don't know, their spouse, or talk to a family member, or there are countless examples. And this is what personally is interesting to me to keep identifying, because that's a major part of the picture as well.
Yeah. Can I put something to you about that?
Of course.
So let's say there's a threshold to be met in the brain and body for an output. And let's say that's threat. And the threat means that the unconscious mechanism of delivering pain is met. And that fires at whatever rate, up to 250 miles an hour, I think, unconsciously, speed-wise. Just like you put your hand away or catch a ball, it's really fast. So the threshold's being met. So there's an unconscious mechanism being fired that's going off at 250 miles an hour. And there'll be a conscious awareness of that fires maybe at 30 miles an hour, 4 miles an hour, different thought patterns, but slower. I think I'm going to lift my arm up, it lifts up. Throw me the ball, it's there fast. So the threshold's met for threat. The unconscious part fires first, already triggers the unpleasant sensation. The person becomes aware of the unpleasantness before they become aware of the thought driving the unpleasantness. The unpleasantness has no meaning because it's related to a yellow taxi that drove by, that relates to a yellow taxi 30 years ago when somebody had pain, or whatever the cue is. And then the pain they have, there's no meaning. And then their default behavior for reacting to that particular pain, it'll be fight, flight, freeze, or fawn, and that'll be a particular system where they'll either go into thinking or moving or shutting down or donut to Netflix, freeze, or whatever. And that's, to them, it was always the best way to deal with that pain years ago, but it'll never actually resolve a pain that's not based on the trigger, actual truth. So the person's in the loop, and the system almost fools them into believing this threat, and it's unpleasant, rightly so, but it's not based on truth. It's based on a patterning mechanism. How does that sound to you as a speed thing? What does that sound like to you?
I mean, it's interesting. I never thought about it in that in those terms. I think that the way I see it, yes, we are a lot of times are conditioned with things that happen to us in our minds, and there are some forces that operate inside us below our conscious awareness. And that's where, and I agree with that in my humble opinion, it does very much relate to when migraine might come. I think that a lot of times, because all those processes are below conscious awareness, and when we look outside, we cannot make the connection between why am I having a migraine right now? Sometimes we do, but sometimes, like, why am I having a migraine right now? It doesn't make sense, because the underlying messages or ideas of danger might not be clear to the individual. And I also think that, especially with the research that I'm doing right now, I'm testing whether the occurrence of migraine and the result of the danger signal is a result of avoidance of needs, avoidance of basic emotions. For example, when we don't allow ourselves to express who we are, like if we don't allow ourselves to really express anger, something happened to us, and we're very angry about it because something that not right, unjustified, happened to us, but we keep suppressing because we don't want to be rude, we don't want to be unpleasant, we live in a society, so we want to be, very a good part of society without letting ourselves lash out or express anger. So I think that anger is something that I found that is very much important emotion that people don't let themselves to express. And so when we avoid those emotions, when we kind of push them down, it's like the system is constantly bubbling inside because it wants to express that. So because it's a constant form of inner stress, we can get a migraine outside, but we don't really make the connection because nothing right now might have happened that I can understand the trigger. But if we look inside, we've been living for quite a while with those unconscious messages of, no, you need to stay down. I'm not going to express myself. I'm not going to express that I'm frustrated or angry because I wasn't brought up that way, and I'm a good person. So those things that are inside, that are bubbling inside us, and we're not aware that they're causing internal stressor, might result in an outward migraine, and we don't necessarily mean the connection. So you are right that there is this unconscious working overwork, and our conscious mind doesn't necessarily follow that. And that's why it's harder to make the connection between the emotional triggers and migraine. And I'm sure that some people are listening to that and says, oh, no, this doesn't work for me. I mean, I don't know what these guys are talking about. I have migraines and I have no emotional issues, and it's not about necessarily having emotional issues, but it is to identify what might be the emotional reason that the system mistakenly think that the individual is in danger, because pain is a danger signal, in my opinion. So it's kind of a road for discovery that is not very clear cut, because we don't have any measurements, like scientific measurements or blood test or something we can do. So
how do you find then that transition from somebody who's very worried about them missing something, or they haven't found anything, and your suggestion that actually we've checked these things that could or couldn't kill you, and you haven't got any of those things, so this is somewhere that you could possibly consider looking, and these are the thoughts. You explain it very eloquently. I'm open to the idea, we both present this to patients. How do you find that transition with patients?
That's a good question. First, I want to emphasize something important, because as I'm talking to other professionals and I find a lot of professionals that it's kind of like either or. It's no, it's only your physiology, it's only your brain, the nervous system. And on the other hand of the spectrum, I also found people that say, no, forget about, every medicine. It's emotional. Every uh, pain you have is purely emotional. And I'm actually, I'm more in the middle, because I think, first of all, that all of us are very, very complex human beings. We're complex creatures, and we're always going to have a combination of physical and emotional in different proportion. Now, I don't know, when I talk to someone, where they are sitting on that spectrum, but what I always say, because a lot of people are coming to me and say, hey, I have migraine, my mom had migraine, my grandmother had migraine, it's genetic, and that's valid. We are aware of their genetic traits that are been linked with migraine, genes that have been identified, that they've been researched, and animal models carrying those genes have migraine-like phenotype. So we are aware of that. But what I'm always wondering is that, yes, you might have this physical component, which I don't disagree, but let's check the emotional component as well, because we don't know how much is there as well. So I always encourage the people that I work with, keep doing everything medically, keep looking, keep going to a doctor, do everything. It's not a substitute, it's to look at the entire picture. I have people that came to me with issues with migraines, and they were not able to find any solutions medically. And in some cases, there were emotional triggers that significantly helped them. And I also had some cases that, people went and they tried for years and years medical interventions. It didn't help. They came to me, and I also wasn't able to find any significant emotional component. And then all of a sudden they found some missed medical phenomena. So I want to emphasize that it's always on the spectrum, but regardless of how much pure, if you can call it that, pure physiological component there is, I always suggest and recommend that we also identify those emotional components too, because those are harder to identify, and those are part of us as human beings. So I hope I'm making sense.
No, you are absolutely. So let's say someone's got a physiological, let's say they've got a phenotype, some genetic predetermination, potential predisposition to get migraines, and they've got family history and one another. But there'll be somebody in that family line with that gene who doesn't have migraine. Yeah, and they'll have the same genetic predisposition. So it's the loaded gun, isn't it? It's the loaded gun. Now, what's different amongst family members is perception, or it can be very similar.
Correct.
So if they know they've got this genetic predisposition and they fear it, are frustrated about it, are worried about it, are concerned about it, that essentially sets the framework that is the filter through which they view their experience and is the danger signal in itself, without them being aware that they're in the danger state.
It very, very well might be. I also had a recent case of someone that told me, yes, I have migraines. My mom had migraine. My grandma had migraine. And so it's genetic. But when I kept talking to her, she also has a couple of sisters. None of them have migraines. So I'm like, okay, it doesn't mean that necessarily it's not genetic, because the fact that she has a sister doesn't mean that they have identical genetics. But I'm always wondering, okay, let's look at that. And also we know nowadays that genetics is not the entire story, because epigenetics is what plays role as well. It's what turns genes on and off, not necessarily if I carry the gene. So I think, again, the picture is more complicated than saying yes or no, but to identify whether is it possible that you convinced yourself that, yes, I have to have migraine. Is that necessarily a given because your mom has a migraine, that your grandmother has a migraine. Again, I want to point out that the picture is more complicated than just, oh, I have the genetics. We have epigenetics on one hand. We have, just like you said, we have maybe imprinting or ideas about, do I have to have a migraine because my mom had a migraine? So this is why I think it's important to look at the entire component and identify what can be at play. Yes, you might have the genetics, but does that mean that you also need to have severe migraines just like your mom or your grandmom? And I don't think that those necessarily have to correlate. So
Yeah, I'd agree. And I think what you're offering then through that, not either or, you're saying actually you keep the genetic predisposition, keep it. A bit like someone says, keep your arthritis, keep your spondylolisthesis, keep your spondylosis, keep your degenerate disc, but you don't need to have the same pain that you currently got.
correct.
And it's that's like, well, okay, you're allowing me to keep my belief around that to some degree, but I'm stepping in the room with you to explore what else do you know, Dan. So now you've got them in the room with you, and they're like, I like Dan, he's the man. He's appreciating where I've come from. Where do you take them? How do you explore the stuff? What do you do?
Okay. So, first of all, it's important for me when I start working with a person that they've done everything medically. They've got a diagnosis, they have a neurologist that treats them, they're on stable medication, that they've done that part. They've ruled out any other medical physiological component. And when I have, and that sometimes happen, not often, that people just starting having some form of headaches and they want to come to me, and I don't work immediately with someone like that. I first send them to get a thorough diagnosis to identify what are the physiological component, because not every headache is a migraine, and I want to rule out any possible causes that are, physiological. But then after we've ruled that out and a person has been on medication for many, many years and things are just going worse and their doctors don't know what to do and there's no medication that helps them and there's no treatment that helps them, then the first thing I do is start interviewing them. And I want to address first their migraine, how many migraines they have, and identify when was the first time that they got a migraine, or to see changes in patterns, like when they say, oh, I started getting migraines in my teens, but when I got to the age of, I don't know, 20 something, all of a sudden it became much, much worse and much more frequent. I want to identify life circumstances, what happened to a person in their lives, just in general, that might have been relevant to that. And usually I'm able to tease a story with the individual. And I think in many cases that I've had lately, I was able to pretty much get an idea of why or what made the system all of a sudden feel under threat and in need of creating more and more migraines from the emotional component. People that tell me, yeah, I started having migraines in my teens because of hormones, and that's valid. We know that hormonal changes do have effect on migraine. But then I was 20 something, and all of a sudden, I don't know, it got worse. And when I identify with them, there's all sorts of stressors in their lives and relationship issues and a lot of emotional stressors that when we go inside and when we identify, okay, so what did you do? How did you feel? We find a lot of inner stressors that they haven't addressed, they haven't expressed. They were just fighting it and trying to, do whatever you can to move on with life, but they've never actually addressed their needs or their emotional needs. Someone has done something horrible to them and they just kept the anger inside without even letting that anger out. something of that nature that I'm starting to identify and link that to say, hey, do you realize that when you have this bubbling inside you, that's probably not helping you feel better? Or sometimes people are saying, well, I all of a sudden starting getting migraine when I was a kid, and when I do more family history and I'm identifying that the family was a very problematic family with a dad who was an alcoholic, a mom who was on um, had mental disorders, whether diagnosed or undiagnosed. There is a link between adverse childhood experiences and migraines. So I review that and identify all sorts of things that happen to people in life that were traumatic to them, like dying of someone they cared about, or being abandoned or neglected or abused in one way or another. And I'm evaluating with them whether there are still internal stressors, internal emotions that have not been addressed. And I also want to say, some people that come to me have already gone through treatment and psychotherapy and went to trauma treatment, but they understood what happened cognitively. They know that, oh, yes, my dad was an alcoholic, but he did the best he could. And I'm always coming to the point of, yes, that's your adult talking, but the kid that didn't get the attention, that didn't get the, I don't know, pat on the back, that didn't get the loving dad that he wanted is still in there. And that kid still wants something. And I think, and from what I'm seeing, is that when people start getting more connected to those needs that have not been ever expressed, though those emotions that they're inside, angers, guilt, shame, frustration from all sorts of things that happen to them, when they are recognizing those and are able to get this in the open and express it in a healthy manner, I find that this is a good point that helps people reduce their inner stress, and in so doing helps them with their migraines. Now, I know that some people end up not having migraine at all. Some people still had migraine but significantly reduced. I mean, I can't say it's like press a button and you're cured. That's not about that. But the fact that there is an strong emotional component that gets people to feel better once they express and experience those avoided emotions and needs, that to me is where I'm trying to get the person to go.
Yeah. And how do you actually take them there?
That's definitely not in not in one time. I think that first, the beginning session for me is to I first get to know someone and get them to know me, to see if they even connect with who I am, and mostly start exploring their life history, their life circumstances, and let them and give them my idea, my hypothesis. And again, it is still a hypothesis, it's not a theory, but maybe in 30 years there will be.
I like it.
But my hypothesis of identifying the roots, the emotional triggers that might get the system to come out with giving the person a migraine, because for whatever reason the system still feels that it's in danger and needs to have a signal of danger to the individual. So I started with life circumstance, what happened, trying to get to know the person and start to identify the links between symptoms in their lives, not just migraine, all sorts of symptoms, because a lot of time there's preceding symptoms to migraine. Sometimes someone gets like mild headaches or cyclic vomiting, and identify what happened in their lives. Are there any traumas, and were those symptoms correlated with those times that those traumatic events occurred? what are some core issues? Because when we experience all sorts of things in life, there are some core issues. Do I feel that I'm unlovable? Do I feel that no one loves me? Do I feel that I'm worthless? Do I feel that I'm not doing enough? Am I a person that needs to take everybody under my shoulders and be responsible for everyone? There's core issues that we're identifying, and we're starting teasing the pieces together, maybe, hopefully, and create some sort of a story of what happened in life on the emotional aspect that might have led the system to be under constant stress, and in so doing bring out those messages of, hey, you're in danger, you need to listen to me, instead of just pushing those symptoms down and saying, no, I don't want a migraine, I don't want to look at it, just go away, which is on one hand natural, but on the other hand, a migraine might be a message or an information, and I would like to explore that information versus say, go away.
Mm-hmm. And so, you're obviously teaching people skills to express emotion.
Yeah, absolutely.
When there's a range of different things, I suppose, that you use for that.
Oh, absolutely. And you know, people come with various skill set, various emotional intelligence sets. So there's a lot of ways to go about it. Some things that I'm actually currently learning is developing emotional skills by looking at emotions and start saying, I feel versus I think, because I think that a lot of people are using those terms interchangeably, and they could say something like, I feel you're not listening to me, or I feel this year is going to be wonderful. And those are actually not feeling, those are thoughts. And I would like people to identify more what they feel. I can say something like, I feel frustrated, or I feel angry because I think you're not listening to me. That might be something different. Or I feel hopeful or feel happy because I think that this year is going to be better. So starting to identify what those components are that are emotions, which many people, you know, we're living in a society that we just shut it down, we just do our thing. And those are important components to start getting more and more aware of. So this is, you know, just a little bit of what can be done to help a person identify what's their emotion or needs. And some people are better at it, some people need a little more help, but eventually I'm encouraging people to be more connected with what is it that they feel and what is it that they felt when things happen to them.
Yeah, I love that. I love it because what you're doing is if that's the thing that makes the kettles boil, but you tend to it before it even starts to bubble up, you don't get the end result potentially. Where's your research sitting at the moment, Dan, then?
Well, I'm currently working with Dr. Mark Lumley from Wayne State University. He created an amazing protocol that's called emotional awareness and expression therapy that there's several randomized controlled trials looking at that for different chronic pain conditions. And when I learned about it about 3 years ago, I was just shocked, because it's like when I heard about it, was fitting so well with what I believe in, what I do. So I contacted with Dr. Lumley, who has been an amazing source of knowledge and information. And we're currently having an active study at University of Utah that we're evaluating the feasibility and effectiveness of this protocol, emotional awareness and expression therapy, for migraine. So we are more at the beginning stages than advanced stages. I can say that the two groups that I have run, we have significant amount of people that after 25 years have seen such tremendous reduction that even their neurologist was, you know, one of the participants told me that the neurologist were just shocked, like, well, what did you do? How did you get to the point that your migraines are in that shape? And we have several people that reported significant reduction after they've been on stable medications for a long time and nothing was working. So it gives me hope that continuing to explore that route and that hypothesis might help many people, which is what I hope, help many people that, you know, they got to a standstill, they got some relief from the treatment they got, but they're still struggling. So hopefully, maybe, I don't know, this new intervention can help people address those things that haven't been addressed and get them to have a significant improvement in qualities of life. We have seen it in several people already. This is a study that is ongoing, and I'm hoping to keep that study going. And if it will be as successful and promising as I'm hoping that it will be, then I would like to have it as a ongoing recommendation for migraine treatment, because it has been recommended for other chronic pain conditions. So,
well, that's really like an inspiration, isn't it? I know research has to be completed and fully kind of assessed, but it's promising, and I'm aware of that treatment approach and its effects for other conditions. And there's boundaries being kind of pushed on lots of different pain reprocessing therapy and the Curable app, and there's lots of great literature, and we're almost at the front of a wave, I think, of optimism in this field. And it's lovely to hear somebody who's at the cutting edge delivering or testing these things. You know, and seeing what you know is exciting, isn't it?
It is very exciting, but I think that most exciting is that we seem to have a new wave of doctors, scientists, therapists, people from all walks of life that are curious or involved in in pain treatment, that realize that the way we were treating pain up to a certain point, by doing whatever we can to reduce symptoms, reduce pain, which again, it makes sense because we want to help people, we want them to feel better. So we reduce the symptoms, but we are experiencing a new wave of professionals who think that, wait a minute, before we push pain down, let's maybe try to understand what pain is trying to tell us. Is there a message there? Is there something we need to look into instead of just saying, go away, I don't want you? And that to me is exciting because it's a new way of thinking. Now, again, I don't know if this is kind of like the end of all. I doubt, because, you know, we're always evolving, but I do feel that this new inquiry might get us to understand or explore things that haven't been explored up to now. And I'm very curious and excited to see where this is going to get us. And especially, I'm hopeful that the people who will experience those new interventions, I'm very hopeful that this will help them, because I see so many people, and there's so much struggle. They're struggling, and they're suffering, and it's debilitating, and you know, my heart goes to them. So if there is something that might be promising or helpful to help any of those people, I will be all for it.
But yeah, makes it worthwhile staying in the field, doesn't it? I think that paradigm shift you're describing, where we now are okay to feel pain rather than suppress it, is the paradigm shift. And I think if we keep moving with that to fully feel that pain, fully feel it, and that doesn't mean it's sadomasochistic. I mean, understand exactly what it is that's happening and feel it and metabolize that moment. There'll be less suffering.
Exactly.
Doesn't mean we won't feel pain in our lives, but the suffering will be shorter, and because it'll be much easier to understand. I get it. And I think culturally our paradigm's been pain equals damage, pain equals damage, pain get rid of it, shut it down, pain push through, pain. It's just too quick knee jerk, which is fine with acute pain. But if the patterns are still going
Exactly.
years after there's a trauma or there was overload in the system. It's simply habituated, isn't it? How would people want to, I don't know if you're happy for me to suggest your contact details
Right.
or anything like that, Dan, but we can add them in or cut them out at the end. But if someone wanted to contact you, they had questions to you, are you happy for me to put
Yes, absolutely.
details on? And do you work
Absolutely.
privately as well as your university work? Are you a private clinician or not?
Well, I am. I'm actually, so right now I'm in a kind of a transition phase. So I'm beside, because I've been doing science and scientific work for many years, and as I found this new intervention, this emotional awareness and expression therapy, I kind of found that this is a big passion that I want to keep pursuing. So right now, this research kind of takes most of my time, and I needed to put my private practice on hold. But regardless of that, I'm always, I mean, we have active courses and active trainings that I'm doing currently with the Danielle Byron Henry Migraine Foundation here in Salt Lake City, and that's a amazing foundation by the Henry family, who unfortunately lost their daughter to migraine, and they're an absolute amazing family, and they're doing so much for the migraine field. So I'm working with them. So if anybody are interested, this is one avenue. And of course, through the university, we have the migraine clinic at the University of Utah, which is phenomenal, with amazing doctors. So there's a lot of resources. And yes, whatever I can do to help or in any shape or form, I'm always willing and happy to do so. So
Oh,
definitely
that's great.
show
Well,
me
on this, whenever we post this, I'll get a list of your contact details and the resources that you offer, and whether you're mothballed for a little bit due to this research, people can look up and wait to see when you're ready to go again, and then maybe they'll be rubbing their hands to come and knock on your door. It's been